robotic surgery basically uses the same principles that laparoscopic surgery uses, such as these long instruments that go through trocars. So the concept is the same and the instruments are basically the same. The difference is you basically have a computer interface in between these instruments and the surgeon, versus when you do it laparoscopically, I'm controlling these instruments and I'm doing surgery using sticks, which is very difficult to do. It requires a lot of skill, and your ability to make very fine motor movements is limited by your instruments. In robotic surgery, a robot, basically a computer, is helping me guide these instruments to perform very fine motor movements and perform a better and more skilled surgery. I would say that most studies have shown that laparoscopic and robotic surgery have equivalent results. I don't think that in most cases robotic surgery has too many advantages in terms of outcomes. The patients do as well as they would do laparoscopically. But there are certain instances, especially when you work in a very tight space, like when you work in, around the area of the diaphragm, or when you work in the pelvis, where since you have 3D visualization, your ability to work is better, and that should translate into better outcomes for the patient, but that hasn't proven it. We did perform a total colectomy. We took out the patient's entire colon because this patient had 3 different